Hello, my name is Paul Rodriguez Lesmes. I'm assistant professor at Universidad del Rosario in Colombia, and now I would like to share you some details about the Colombian healthcare system. So first, Colombia is a country in the north of South America, so we speak Spanish here, and this country has the characteristic that it's a Caribbean country, like the photo you see there, and this one as well, but also it's an Andean country. So there is a quite large diversity on the type of cultures, weather, and disease environments that we're facing. As you can see in the map in the right, the population of the country is concentrated on several cities. Around 80% of the population of the 50 million people is in the cities. And some of the cities will be in the high of the mountains, as the one you see in the picture, or as the others that you saw before, they are in warm places near the sea. So the picture here of Bogota, the capital, also tells you something important, is that the country has an important amount of inequality in terms of income. You have large modern areas of the country in the cities, but at the same time you have a lot of people who is living under poverty, right? Like in the photo here, you can see this contrast. So as a result, the country is facing an interesting scenario, which is common for middle income countries. So you have a population that has the capability to pay for health services and services in the standard of Europe or in the US. But at the same time, you have a population who is living under poverty and won't be able to pay a health insurance or similar. Moreover, the country also is sparsely populated in most of its extension. So you can see in the graph, again on the map on the right, there is more or less half of the country is barely populated, either jungle or large savannas and similar areas. So for instance, here, the one that you see is one of the capital cities of the country, that's called Arauca. And in this case, Arauca basically is very hard to arrive. There is no real road to arrive to Arauca. So you will arrive only by plane. And this will make it very expensive to bring health technologies into an important area of the country. Who get access to health in Colombia? Essentially, all Colombian citizens are entitled to be part of the health system. But these also include people who is not formally citizens. So for instance, now immigrants from nearby Venezuela that account for nearly 2 million inhabitants of the country have access to the health system of the country. This is designed to be a universal care system. Currently, that covers nearly 96% of the population. This 4% is mostly due to frictions on who is insured at what point of the time. So here what we have is a managed care competition in insurance. So essentially, there are several insurer companies that will be competing in order to attract their patients. So how it works? Formal workers like me, who have a stable job, will be paying a contribution, a payroll tax for the compulsory insurance system. So I have to pay a certain amount of money, and then I will choose one insurance company. People have also to pay some co-payments and premiums, but it's based on income alone. So there is no competition in terms of the actual premium. This premium is decided basically on the amount of money that you earned every month. For informal workers, which will be the case of our friend in the photo, so it's very hard for them to try to pay for an insurance, even if it will be compulsory. As a result, what we have is a subsidized premium for them. Actually, for the poorest individuals in the country, there are no co-payments at all. So health will be completely free for someone who is in need in the country. Even in some cases, due to conditional cash transfers, there will be benefits if you get access to healthcare. That's for the specific case of preventive healthcare for children or for pregnant women. In terms of private and market, we have a voluntary insurance scheme There are two. One is supplemental, that is essentially not that expensive and that will involve some extra perks for individuals who are in the compulsory insurance system. And there is a substitute system that is a pure insurance, and that is relatively expensive, but it covers less than 2 or 3% of the population. So which is the structure of the system? Essentially, we have a primary market that will be this like a rectangle here is households are choosing their health insurance. As I was saying before, there is no competition in terms of the prime that you're paying for them. So it's only about the perceived quality that you get. Households would do is to pay their general taxes like the VAT or the income tax and similar. And those resources will be allocated back to health insurers via capitation rule. So this could be either for the subsidized system or the mandatory system. And there is also some resources that will go for technologies that are not in the basic health benefit plans. So this will be reimbursed by the government to the health insurance. The government also transfers resources for public health, catastrophic events, and non-insured population to the local governments. Both the local governments, health insurers, take part of the secondary market. And in this secondary market, they will contract services with health providers, which could be public, private, mixed, for profit, not for profit, and similar. The idea is that there is competition on this secondary market, which works mostly in cities. In scarcely populated areas of the country, basically, there is only one health provider and one health insurer in some scenarios. Which is the bright side of this? So while Colombia is one of the most unequal countries in the world in terms of income, actually there is no inequality in terms of access to healthcare. What you can see here in this graph is that health insurance coverage is the same according to the income quantiles. And it happens the same when you go for rurality. This health benefit plans is in general generous. So medications are included. If you are poor, you can get a copayment of 0 for any service or even medication that you will get. Most treatments are included. So there is a few exceptions that are based on experimental technologies or foreign-based procedures. So the country is generous and do a quite large investment in trying to deliver services. So for instance, here you see some people trying to bring vaccines, COVID-19 vaccines, into scarcely populated areas of the country, right? Using whatever is available in each region. And that also means that private pharmacies essentially need to sell, for instance, ice creams and other type of services, because it's not as profitable as will be in other countries to have one of these type of firms. There is also some growing recognition of cultural diversity, as you can see in this photo. This is some of the people from the Wayuu culture in the north of the country who have one health insurer which belongs essentially to them and which mixes traditional healthcare with modern Western healthcare services, right? One of the advantages of these type of services is that out-of-pocket expenditures are quite low. This is now the graph that I was presenting. Essentially, Colombia has a level below the average of the cooperation and development group on the world, and it's quite below the level of out-of-pocket expenditures from the level of Latin American and the Caribbean. So that's on the bright side of this story. But still, of course, there are points to improve. I was saying that there is no inequality in terms of insurance, but in terms of effective access to healthcare, there is still quite large inequalities, especially in this urban-rural division. So as you can see, in the cities, you will access to the best possible health technologies in the world. But in dispersed areas, like this case, this is a hospital in the capital city of Chocó, one of the states of the country, like the quality of services is quite bad, right? And this heterogeneity, like like fuel in part because of the fragmentation of the health system. So if a health insurer doesn't comply with the obligations and delay appointments and doesn't pay the health providers, for instance, then this new amount of debts that grows because of this source will result in more barriers to access and implicit prioritization of services. That ends up on problem, like for instance, here, health professionals like fighting because the provider is not complying with their obligation, is not paying wages, right? So all of these elements are like in the same health system. There are other problems associated with this fragmented health system is the management of public health. So it's not very clear for certain type of interventions if it should be the health insurer or if it should be the local government who provides certain characteristics of care. Right? And what I was saying that there is cultural diversity, this is not complete. There are many communities in the country for which cultural diversity doesn't apply. And this is important, for instance, in the case of midwives, which are not recognized as part of the health system, while it's very clear that they provide an important services in some of the scarcely populated areas of the country. Lastly, but not the least one, probably the most important one is corruption. Corruption is a very big issue in middle income countries, and especially in health systems that are as generous as this one. There is an important problem with this, right? Like false cases, medications and procedures more expensive than what they should be in some areas of the country and similar, right? While we have a good information technology system, all these characteristics are still present. Okay, this is what I wanted to share with you. Thanks.